Well, we're now finding out just how technology can help individuals, businesses, and communities protect mental health and alleviate loneliness during this COVID-19 pandemic. Dr. William Kassler is Deputy Health Officer and Lead Population Health Officer for IBM Watson Health. And as a public health expert, he spent his whole career working at the intersection of clinical care and population health. Welcome, Doctor.
Thank you.
Well, Doctor, C-19 continues to upend normal life and put stress on individuals, families, communities, and businesses alike. While much of the world's population exercises social distancing or experiences total lockdown, this is to protect one's physical health, the resulting feelings of isolation may exacerbate two other growing problems. Health problems, in fact, loneliness in the elderly and the ongoing global mental health crisis. Dr. Kassler, how is isolation during this pandemic impacting loneliness and mental health?
So it's important to understand that mental health and loneliness and isolation existed pre-pandemic, and we were emerging to understand the public health importance of these before COVID hit. Now, with all of the disruption, the stress, the anxiety, the economic issues, it's just making all of these existing and sometimes hidden issues worse. So loneliness is not only harmful to our mental health, but it turns out that it's also harmful to our physical health. Being alone and isolated is the equivalent of smoking 15 cigarettes a day in terms of our mortality rates, for example, at the same level as obesity or lack of physical activity.
Wow. How does that equate to 15, not 20, not 10? I mean, that's an interesting number.
I think people look at studies of folks who say they're lonely, follow them over time, find out what their health is, and that's basic epidemiology. And then they look at the risks of smoking and diet and exercise and being alone, and that's how they come up with that equivalency.
Medical research cites loneliness. I think the number's like 26% increase in the overall mortality rates too. Now, a recent report from IBM Institute for Business Value, it includes research on how loneliness directly impacts personal, economic, and social well-being in older adults, while outlining the major role technology. This positive change, especially during the COVID-19 pandemic. Can you tell us a little bit more about Watson's up to?
Sure. So technology can never be a substitute for good quality interpersonal face-to-face interactions. But when that's not possible, we think technology has an important role. Just think about adding the video and the gestures and the pictures and the nonverbals to our conversations over the phone. Can certainly help all of us, but for folks who may have dementia or confusion, that can really be a lifeline. Technology can also help to coordinate care, to keep our elderly safe at home with the services that they need. Technology empowers mental health providers and doctors to be able to deliver remote visits safely and securely and effectively, and it makes it easier for us who need those services to access those care. And sometimes we're even more comfortable talking to a computer or a screen than we are in face-to-face, given some of the stigma involved. And so here technology can actually be a real plus.
You know, we're used to seeing movies and so on with robots in them. The day will come eventually, I guess, where we'll have a house robot, you know, do this, do that for us, and it'll become like a real person, I guess, to a lonely soul on their own in an apartment, flat, or even a house, you know, literally being like another person there. I don't know about talking back, but I suppose that'll happen as well one day.
Well, right now, we're really focused on helping tech get people to people, and again, we're not saying that it's a substitute, but being able, when we're physically distanced, to reach out and socially connect. I think that's really what's happening today, and it's hugely valuable.
Yeah, and what else has come out of different sorts of surveys? I mean, you've been in this game a long time. You've seen a lot of things. It's not just the elderly, is it?
No, I think we're all, whether we have a pre-existing depression or anxiety or stress, whether we're a teenager, a mom trying to be homeschooling and employed, and at the same time, this is stressful for every single one of us. And once again, I think if we look at how we can build resilience and cope, a huge part of that is self-care. It's taking care of ourselves. It's putting on our mask before putting on someone else's. And mobile apps can make a difference in terms of stress and mindfulness. Online platforms, remote visits, as we talked about. But it's really all about keeping some sense of normality in our own lives, finding things to be grateful for every day. Just taking care of ourselves and before we take care of others.
It sounds like a total mind shift in a lot of ways, doesn't it? I mean,
it does.
When you look at your background prior to joining Watson Health, you served as a chief medical officer for the New England region of the Centers for Medicare and Medicaid Services, CMS, but you're a founding member of the CMSInnovation Center, and this was about creating a value-based purchasing initiatives to improve population health. You've seen a lot of things. Do you have any, out of the box ideas and thoughts for the future, where we're heading, what we could do for people?
Well, I'm an optimist by nature, and I look at innovation and I look at all that can be done. I see AI as being very, very empowering to help decision makers in businesses, clinicians, and individuals understand a vast amount of information and leverage that information to help us make better decisions. I am, though, cautious because I think it's a wild, wild west out there. We have technology that is the good and the bad and the ugly, and it's really important for doctors and professionals and folks like yourself to hold us accountable, to curate and make sure that as we develop the tech, that it's based on science, it's got good user interfaces, and it's secure in terms of our privacy as well.
Dr. William Kassler is the gentleman I'm speaking with today on the Mark Bishop Show. He's been recognized, folks, with numerous awards from the United States Public Health Service, including the Surgeon General's Mauritius of Service Award. He recipient of the New Hampshire March of Dimes Physician Leadership Award and the Bi-State Primary Care. This was the Association President's Award. Very good. So people listen to you, and you're seeing it every day. You must be very concerned in a lot of ways, Doctor. This artificial intelligence, I mean, it can really help, can't it? And where can people find out more? What can they read up on it? Where can they go?
I'd suggest going to our website at ibm.biz, /COVID health, where you can get some of our writings on aging and mental health and AI for good.
It's all there. That's good. Just give us one more time, would you? That gives people a time to grab a pen. Just give that address again, if you would, Doctor.
Certainly, www.ibm.biz, /COVID health, all one word.
That's fantastic. It sounds like good reading, worthwhile going to, Dr. William Kassler. A public health and IBM public health expert in the role of technology in combating loneliness and supporting good mental health during this terrible time that we're going through. And Doctor, thanks for giving us your time. I know you're very busy, but thank you indeed as the Deputy Health Officer and Lead Population Health Officer for IBM Watson Health, Dr. William Kassler. Thanks, Doctor, and you have a great day.